Maternal-fetal medicine plays a critical role in caring for high-risk pregnancies. Now available through CMU Health, these specialized services bring expert care closer to home for families in our community. As part of BWell Saginaw's Safe and Separate Sleep campaign, Dr. Jennifer Caruso, maternal-fetal medicine specialist, discusses the importance of this advanced level of care and how it supports safer outcomes for both mothers and babies. How are you, Dr. Caruso?
I am very good. Thank you so much for having me.
I'm so excited to have this conversation with you to talk about maternal-fetal medicine. I think a lot of people out there may not know what it is, that specific word, but they know the services that you do. So I'm excited for this conversation today.
Yeah. So I'm glad to be here.
Thank you. So let's just jump right into it. What drew you into the field of maternal-fetal medicine?
It was a little roundabout, actually, because during medical school, I really enjoyed everything. And then I got to obstetrics and I loved it. Had an opportunity to have some great experiences. And then decided that I really liked women's health. And so I matched into OBGYN. And then in my years of training in OBGYN, I realized how I really got a lot of energy from the days that we had difficult patients, the things that were tough, when you had to make hard decisions, when you had to really think quickly, when you got to be there on the very best days and also the very worst days of a pregnancy. And it was like the perfect field for me. And then I also really enjoy talking to patients and teaching. And that's what I feel like a lot of our counseling is teaching patients about either their pregnancies, their babies, the ultrasound.
Yeah.
So just kind of a combination of all of it. And I can't imagine myself doing anything else.
That is awesome. So, you said a lot, right? And I think we have to really explain the difference of what OBGYN is, obstetrics, and maternal-fetal medicine. Can you explain that difference? What is it?
Sure. So our focus is really on pregnant women. Pregnant women and the things that can happen in a pregnancy. So I kind of see it as there's sort of three key components for maternal-fetal. There's things that can happen to mom, because mom has high blood pressure or diabetes or something, that chronic condition. And then there's baby things, with ultrasound. Either we find something on ultrasound or we see that baby is small in the pregnancy. And then there's pregnancy complications like high blood pressure from pregnancy or preeclampsia or diabetes that happens in a pregnancy. And so there's kind of three pieces of every pregnancy that we kind of pay attention to. And it's really just that focus on the pregnancy and a pregnant patient, as well as a woman who might be thinking about pregnancy. So coming to see us beforehand because she's thinking, well, I have these chronic conditions and I would like to be pregnant in the future, thinking about what her risks are in a pregnancy.
Gotcha. So I think what initially used to come to my mind when I thought about high-risk pregnancy, I always thought age. And it's not that. And I mean, it's probably ignorant to think that, but that's what I thought. It was just an age thing when it came to women. But you're saying that it could be chronic conditions. It can be a multitude of things.
Yeah. Age is one of the things. We certainly see our fair share of patients who have, age-related things like genetics, but then a variety of other things. Moms who come into pregnancy with diabetes, type 1 diabetics, of course, are at a higher risk for pregnancy complications. Women who maybe have lupus or who have their own heart conditions. And then the other key component for maternal-fetal medicine is ultrasound. We do a lot of ultrasound in our office, looking at baby from head to toes or checking the baby's size to see that maybe baby is small or big. There's a variety of things that can happen on an ultrasound, and we will look at those things to to diagnose something for baby or for mom, and then follow, make plans about how are we going to follow this, or what are we going to do as the pregnancy continues.
Wow. So when this patient is coming in, or you said they could have the conversation with you beforehand. So do they just make a call to you? How does that process work?
So most patients really get to us from their OBGYN.
Okay.
She will see her OBGYN, who does a great history and finds out, oh, you have this family history, or you have this thing that maybe you should talk to a high-risk person. Or a patient who's seeing her OBGYN for her annual, and says, I'm thinking about becoming pregnant, but I do have this and I'd like to talk to someone. So the vast majority of patients are coming to us as referrals. They have something that gets them into the door to come talk to us.
Got it. And so what cases are you seeing the most? I know we talked about different chronic conditions, but if you could just, make a statement, what kind of cases do you see the most?
Probably diabetes, which I think of as my bread and butter, I guess, little pun there. But we see a lot of diabetes in pregnancy. That complicates a lot of pregnancies. High blood pressure, and then age, like you mentioned. We see a lot of patients who are just older in pregnancy. Although the vast majority of older moms still have nice, healthy, normal pregnancies.
So any women out there who's considering, you can still have a normal and healthy pregnancy. So
yes.
That's really good to hear. And it sounds like you're pretty busy at CMU Health.
We are. We do a good number of patients every day. We're there doing consults every day, Monday through Thursdays. And then on Fridays, we also do some ultrasounds for maybe slightly lower risk patients. But we are pretty busy. But if there's urgent referrals, of course, we do everything that we can to move things around. Sometimes a patient has an ultrasound at an outside office and they find something concerning, or some blood work comes back really abnormal that they need to get in with us, and we will work those patients into our schedules however they need to be seen.
Yeah. Well, that's good. That's good to hear too, because I know in some cases it can be very hard to see a doctor sometimes.
Yeah. And it's so hard to wait, because in the meantime you're Googling or you're finding things online, and it's hard to wait. So we do what we can to kind of triage patients and make sure that the patients who are at most need get in as fast as they possibly can, based on what is going on, what conditions we're concerned for.
Okay. And so when I'm thinking about sessions, I know, like, I've talked to different centering and nurses and things like that. And so they only get to talk to their doctor for like 15 minutes. And then is the appointment times similar when it comes to a high-risk specialist?
Not really. Ours is usually a lot longer. Almost every one of our patients is scheduled in at least like an hour type slot. Sometimes if it's a return visit, it might be a little bit shorter than that. But our visits are a little bit different as well. So when the patient comes in, our nurses will take them into the room, get a basic history. Then they get an ultrasound. Every one of our patients who's pregnant will get an ultrasound, and each of those ultrasounds is about an hour. So they spend about an hour, looking at baby, getting growth, looking at all the structures. And then while the patient's there, they will see one of the physicians, where we do a more in-depth history and then talk about our ultrasound findings or anything that we need to talk about based on why the patient is there.
Got it. Okay. And so if someone who was had high risk pregnancy before, are they more likely to be high risk again in the future?
Usually, it, of course, depends on the situation. If there was an early delivery or if there was high blood pressure during a pregnancy, she's probably more likely to do something like that again. A small-sized baby, because, it kind of can run in a family. There are some genetic conditions, of course, that can run in families. So it is a little bit more likely that a patient would end up being high risk again. But that doesn't mean that it's necessarily going to happen. And so we're there to help support the patient and her family along, the whole pregnancy. And if she has nerves or anxiety because of that history.
Yeah.
We're there to kind of answer those questions and also make sure that we can help her feel a little bit better, give some reassurance.
Well, that's good. And that's good to hear. I was kind of curious about that. Like, I was on TikTok, of course, and I was listening to someone who did have a chronic condition, and she talked about being in pregnancy with one of her children, and then it was a high-risk situation again for her next one. So I was kind of curious and wanted to ask you that.
It's a little bit more likely, but it doesn't mean that it'll always happen again. So certainly getting plugged in with the OBGYN early and then getting a referral to us if needed is definitely helpful. And it can be reassuring just to come see us, even if she's not high risk the next time around, just so that we can give that reassurance that things are going to go different the second time.
Makes sense. So why was it important for CMU to bring this service to the community?
I mean, pregnancies are a high risk state, just being pregnant. And unfortunately, pregnancies are becoming more risky. Even though fewer women are giving birth, women in general are going into pregnancy a little bit older, a little bit higher risk because they may have other chronic conditions. And so we know that the maternal or death rate for moms is increasing, and it's increasing even in the United States, which is really alarming. So having this service in this area is so important because as women are getting older and having children, and as they have these chronic conditions going into pregnancies, we need to have that support for them to make sure that they can be taken care of during pregnancy.
Yeah. And that's so important in what you just brought up as far as like the maternal health factors. Working with BWell Saginaw, they put out their community health plan, and we're noticing, like you said, some of those outcomes where women are not having good pregnancies in a sense, like you said, the death rate, and then also just their feelings towards going to some healthcare provider. Sometimes it's hard even racially. So what has been your experience with that, if you could speak on it? Have you noticed any differences there as far as like maybe just racially or just economically? Have you noticed anything?
We know that women, of certain racial groups as well as socioeconomic status are at a higher risk for pregnancy complications. There's a higher risk for having a small size baby, having an early delivery, having a stillbirth. And so just getting to a physician can be the first step. And as high-risk doctors, our goal is to make sure that we identify those high-risk patients and make sure that they have treatment plans that also work for them too. That we're seeing them often enough and helping them to get to appointments and helping them, to deal with all of their stressors in life, making sure they have access to, healthy food and their appointments. So we definitely are seeing more and more, higher risk pregnancies. And so making sure that our patients can get plugged in and get seen is so important.
Well, thank you for that. And many thanks to also CMU for having this particular service. It sounds like this was very much needed in the Great Lakes Bay community. So I have to also kind of get into our safe sleep because BWell Saginaw and its partners are working on their Safe and Separate Sleep campaign. And while I know you're on the OBGYN side, the maternal-fetal medicine side, when should families start to have those conversations around safe sleep? Are you doing that as a maternal-fetal medicine doctor? Do you have those conversations with your patients?
I don't have specifically that question, although at the end of every one of my visits, I ask my patients, do you have any other questions? And sometimes questions about, care for baby and things like that come up, lactation. And I try to answer them the best I can because I'm also a mom. Yeah. And so I have that experience. But frankly, when it comes to OBGYN, I'm really good when baby's inside. After baby's born, I have kind of some of the same questions that the patients have for us. And so that's when I refer to our esteemed pediatric colleagues because I don't have all of those answers. Now, that being said, I know that every patient, when she gets that positive pregnancy test, I mean, we think about coming home with our little one, protecting our babe, keeping them safe. We're here for the safety during pregnancy, and then our pediatric colleagues are there for safety afterwards, and making sure that we have a healthy infant at the end of the day. And a healthy mom, of course, is really, I mean, that's what we're focused on from our specialty. But bringing home a healthy infant and making sure that baby stays healthy is so important. So BWell, I have to thank them for these sessions, because it is so important. I mean, all of that work and all of that effort that goes into having a healthy mom and a healthy baby, and then we take care of our little ones afterwards. So safe sleep is so important. Obviously not something that we're focused on during the pregnancy, but absolutely our pediatric colleagues. And in centering, I know that they talk about that.
Yeah, definitely in centering.
Yeah, and then pediatrics, of course.
Yeah. Well, thank you. That is really amazing. And I love the fact that you talked about the pediatric specialist. And it just seems like this network that's happening. And I think CMU Health, specifically Women and Children Center, offer all of that in one place. You have your OBGYN, but you also have maternal-fetal medicine. So if you are high risk, there's someone that you can talk to. There's a physician there that's there. And then for the baby, there's pediatricians that's available as well.
Yeah, absolutely. And sometimes you don't know you're high risk until something changes in the pregnancy. So being plugged in with CMU, we have those resources available to moms and babies, from the low risk all the way to the high risk.
That's amazing. And so I do want to ask a question though, and I know you're on the mother side, the pregnancy side, but it made me think about the TikTok that I was telling you about with the woman who had the chronic issue. She discussed having a premature baby and said that, there could be complications when you're like strapping them up. So is that also a conversation that you would have with your patient as far as having a premature baby, and maybe if they're resting, like, do you talk to them about that?
Again, I kind of leave that for our pediatric colleagues. I had term babies, so my kiddos were chunkers, honestly. Yeah. So that's my only experience, honestly, with kiddos on the outside. But honestly, our pediatric colleagues are amazing, and they can go through all of that, and they do such a great job of making sure that moms have that education. And then our regional NICU, as babies get discharged from there, from maybe being early or having a short stay for something like being premature, they will go through all of those resources and the education to make sure that babies are properly positioned for in their car seat, or of course for safe sleep. That they're in a situation where they're safe.
Definitely. Let me ask you this: how, after the patient delivers, do they follow back up with you, or do they just go back to their regular OB provider?
They mostly go back to the regular OB provider. If there are major complications in a pregnancy, I always make sure to offer that a patient can come see us after a pregnancy to talk about future pregnancies. What might her risk be in a future pregnancy for something like whatever happened during the current pregnancy, have it happening again.
Okay, gotcha. And I have to ask, because you brought up genetics earlier. So I'm just curious, what type of genetic conditions do you see as a high-risk specialist?
We talk about age a lot, which kind of relates to genetics. And then sometimes if we have an ultrasound finding, or maybe multiple ultrasound findings, we'll talk about how, if there's something that we see or multiple things that we see, it could be related to genetics. And in that case, we might think about doing a procedure like an amniocentesis, where we collect a sample of the fluid, or even the procedure that's done earlier in the pregnancy, which is like a biopsy of the placenta. We offer those in our office, and we do, basic genetic counseling about age or ultrasound findings, or even patients who are known to be carriers for the same genetic conditions, that's where that diagnostic testing with those procedures can be really helpful.
Understood. Makes sense. I was just so curious about that too. And then also CMU Health has a geneticist as well.
Yes.
So just more services to add there. So that's really amazing.
Yeah.
Thank you. So is there anything else that you would like to add to this conversation before we wrap up? Well, as we wrap up.
Yeah, I can't think of anything. I think that this was very fun. It was nice to talk about, our services, of course, as well as all of the things that CMU can offer.
How can people out there who's watching and listening to this, how can they find out more about maternal-fetal medicine?
So the best way would probably be at the CMU website at cmuhealth.org. And then also, if you have questions or need to get directly to our office, it's really through the OBGYN. So talking to your OBGYN, asking questions about, am I high risk? And, is this something that I should speak to a high risk doctor?
Awesome. Thank you so much, Dr. Caruso, for being here.
Yeah, thank you for having me. This was fun.
Thank you.